In the past, I used to be the head of the whole Msc Program, so I've got a good understanding of what it involves. There are several unique features about this Msc course. Firstly, the clinical modules all have the option to be 10 or 20 credits. The 20 credit options involve teaching and attending clinics, specialist clinics in the local hospitals to get a really in-depth understanding of the course. Whereas the 10 credit modules are just classroom-based teaching, 3 intensive days with a follow-up assignment. So people can choose what's right for them. If your need and desire is to set up clinics in your own community, or you want that experience of seeing clinics that you might never otherwise get to see, the 20 credit options are perfect for you. But for somebody who lives a great distance away and just wants the quality learning, then they may find the 10 credit modules work. Other unique features are the fact we only use local experts to teach on the course. We know the people we're working with. The people are really passionate and they do their research and all their teaching here at the university. So we've got a great community feeling here. There's a good team spirit. And of course, I've got to say the University of Birmingham campus is absolutely lovely as a place to come to learn, and the follow-up and the educational experience is quite special. The MSc in Clinical Primary Community Care is really aimed at qualified general practitioners or those who are nearing the end of their GP training, so that's qualified doctors who are specialising in general practice, or experienced community nurses, nurses who work in the community and want to learn more and specialise more in specific areas of practice. For any prospective student, it's worth understanding that the modules are spread throughout the year. The teaching on the clinical modules is in the form of 3-day blocks, so solid 3-day blocks together, with follow-up clinics in the community which are spread over several months. There are 2 compulsory modules for those wanting to complete the full MSc, and those are longer blocks of a week or a fortnight, which have to be done here at the university. So it's quite an intensive commitment to put it all in 1 year. However, we encourage people, because so many of our participants are clinicians in practice, we are very comfortable with you taking 2 or 3 years to complete the whole course, and that's a completely acceptable way to do it. And sometimes people get more out of the course spreading it over a longer time around their clinical learning. They can put it all into practice. The Msc Program has various outcome options for the individual, and it depends what you want from it. Firstly, it is an academic master's level qualification. So for somebody who wants an academic career, it's a fantastic stepping stone. It gives a strong theoretical underpinning in research methods, epidemiology, statistics, but also gives an excellent range of clinical modules for somebody wanting to expand their practice. So for somebody whose aim is high quality CPD and perhaps specialising in certain clinical areas, they could choose things that suited them. We have a range of cardiovascular disease options. My personal module, which is community gynecology, would enable somebody to have an in-depth understanding of community gynae issues and give them the confidence to set up a community gynae clinic. This course is quite unique. The clinical focus that can be directly applied to practice is something very special that participants value hugely. The opportunity to interact with the tutors and keep long-term friendships with the people you study with is very special. And the University of Birmingham itself is a really amazing place to work and study. We have a beautiful campus, an amazing history of high-quality research and education, and actually we have a lot of fun on this course. I love the people you get to meet on the course, both the participants and the tutors and trainers. So the participants are a really wide range of healthcare professionals. We sometimes get incredibly experienced nurses who've done it all in the community but come along because they've got a specific focus. They want to set up a clinic, but in the meantime they think, actually I'd like to gain an MSc qualification. We get some young, enthusiastic, bright academic GP trainees who come along as part of a stepping stone to a future career, going on to do a PhD. And their enthusiasm is really infectious. And then you get people at all stages of their career who want high quality CPD. The tutors are all local, so we have GPs and clinicians, sort of consultant gynecologists from local hospitals, and these are the people that I correspond with, the people that we write the letters to, and it's great to meet them in person and build up relationships, and certainly participants on the course really value that opportunity. We factor in lots of time for question and answer sessions, and that really adds to the richness.